Great.
Just waiting for people to connect their audio. Good evening, everyone. So nice to see some of you and see your names on the screen. My name's Diane Gould. I'm the CEO here at Advocates, and I want to welcome you to our family forum to talk about vaccines for your family members. I'm here tonight with our Chief Medical Officer, Dr. Mark Viron, who will be doing a presentation, and Nicole Saint Amand, a member of our team who will be moderating this forum, and she'll tell you what that means in just a moment. There are also several other members of the Advocates team on the line tonight, and we're here because together we want to share with you the information we think will be helpful and answer any questions that you may have. So before we get underway, Nicole, do you want to just do some housekeeping?
Sure. Thanks, Diane. Hi, everyone. My name is Nicole Saint Amand. I am the Senior Director of Marketing Communications at Advocates, and I will be moderating the call today. Just a few housekeeping things. We are recording this open forum, just so you're aware. You may choose to have your video on or off, whatever you're comfortable with. As Diane mentioned, Mark will be given a presentation, and we'll open up, for questions or comments or anything. And there's two ways to participate in that. You can type your questions in the chat box, and I will be able to read those out loud, and a staff member will answer, or you can either physically raise your hand and I'll call on you, or there is a raise hand feature. If you click on the bottom of your screen, there's a participants button. When you click on that, there's a blue hand, and you can click on that and it'll notify me, and I'll put you in the queue and I'll call on you at that time. Goes without saying, stay on mute unless you're speaking, and I can help turn mute on and off for you. If you have any questions or technical issues, please private message me in the chat and I'll be happy to help. And yeah, when called on to speak, you can unmute yourself and just announce your first name. And I think that's about it. So I'm going to turn it over. I'll also put these in the chat, these housekeeping in the chat as a reminder too. So
great. Thank you. Before Dr. Viron gets underway, let me just say something you may know, which is that the information about the rollout of the vaccine, the actual process for vaccination, things continue to change. And so we're giving you the information we have as of today. It's not, one or two of the slides may even, although they're new slides, they may even already be a little bit out of date. So we will make corrections as we go. Also we're committed to keeping you updated as things continue to evolve. Dr. Viron, do you want to get us going with the presentation?
Great. Thanks a lot, Diane. Thanks everyone for coming here tonight for this important topic. I'm really pleased to be able to get to talk to you about an important decision you have to make on behalf of yourself and your loved ones and the people that we provide care for here at Advocates. I'm going to share my screen, so give me a second here. I'm going to run you through some slides for about the next, it'll take 10 or 15 minutes. Let's see if I could get this a little bigger. All right, Nicole, we can see the slides okay?
yes, perfect.
Okay,
Mark.
great. So what we're going to talk to you, COVID-19 vaccine, we're going to talk to you about the basics. What we feel like you need to know, and hopefully provide you with some information to make the decision around getting the vaccine. So just a review of where we're at right now. So what do we know about COVID-19? Well, the infection with SARS-CoV-2, which is the virus that causes COVID-19, can result in a range of illnesses from mild symptoms to severe illness and death. Unfortunately, we still don't know how SARS-CoV-2 will affect each person after they get infected. We have an idea that there are some groups that are higher risk for severe outcomes, but we still don't know on an individual basis whether you'll get asymptomatic illness, mild illness, or up to and including death. We do know that people are in higher risk brackets, people over the age of 65, people with some certain co-occurring medical conditions. We also know that the people that live in our congregate care settings are at particular risk. And there's been some studies done since the start of the pandemic. This kind of showed rates several times higher than the general population. How to prevent COVID-19. So the vaccine is one piece of this. It's a new piece of it, but we still have the reliable standbys that we're going to continue with for the time being, even after the vaccines start to roll out. That's wearing a mask, avoiding close contact with others, do the physical distancing, avoiding touching your eyes, nose, or mouth with unwashed hands, cleaning and disinfecting frequently touched surfaces daily, washing hands often with soap, and if not, hand sanitizer. We're going to continue to do these things in all of our congregate care settings for the foreseeable future, even after the vaccine rolls out. There'll be a time, hopefully at some point in the future, where the pandemic will, start to wrap up, and we'll be following any updates to the guidelines. But for now, all of these things are going to still be in place after the vaccine starts rolling out. So the new measure, there's 2 vaccines that have been approved, and you may have seen the news back in December about these 2 vaccines by 2 different companies, right? Pfizer has one and Moderna has another vaccine. They're both 2 doses. Pfizer one, you get it about 3 weeks apart. The Moderna one, you get it 4 weeks apart. Both vaccines were tested among tens of thousands of adults from diverse backgrounds, including older adults and communities of color. The trial data showed that both vaccines were remarkably effective and safe. It's unknown how long protection from the vaccines will last. And one important point to make is that the vaccines are being held to the exact same safety standards of all vaccines. A little bit about what an mRNA vaccine is. So the first 2 vaccines, there's a few other vaccines in the pipeline. These first 2 are what are called messenger RNA vaccines. These teach our cells how to make harmless pieces of the spike protein, which is part of the SARS-CoV-2 virus. After that protein piece is made by the cell breaks down those instructions, the mRNA. That's what the vaccine is giving you, is pieces of those instructions, and gets rid of them. The cells display that protein, that spike protein, and then it triggers an immune response. Your body recognizes that, hey, that's not supposed to be there. The immune response gets triggered, and your body mounts a response to it. So next time it sees it, it'll be able to kind of combat it and get rid of it and do what it needs to do to protect you from getting ill with COVID-19. mRNA vaccines do not use the live virus that causes COVID-19. The vaccines do not give you COVID-19 and cannot give you COVID-19. The other thing to note about mRNA vaccines is the mRNA doesn't affect or interact with our DNA in any way. It doesn't even go into the nucleus of the cells where the DNA is, but just some concerns that some folks have had about these mRNA vaccines. So as you know, vaccine supplies are limited up front. They're going to start to continue to expand over the course of the next several months. But first in line are healthcare personnel, group home staff, and residents. Why are they in the first line? Well, they're on the front lines. There's a high risk for exposure. These are particularly vulnerable populations and the potential to transmit to others at higher risk. So along with being first in line, we know there's a lot of questions. So we'll try to answer some of the common ones here. So about the vaccines are expected to produce side effects after you get the vaccine. They most commonly occur after the second dose. They're more common in younger people under the age of 55. The common side effects include fever, headache, muscle aches, and fatigue. You're most likely going to feel crummy after you get the second shot. The first one, some people don't notice much besides a local injection site pain. So where you get the vaccine in your arm, that might be sore for a day or two. These side effects, typically resolve. They start around the first day of getting the vaccine, and they typically resolve within 3 days. The clinical trials didn't show any significant safety concerns. At least 8 weeks of data were gathered, and they continue to gather data in an ongoing way for all the people that were vaccinated back in the studies. And it's unusual for side effects to appear from vaccines after 8 weeks. So we've got a good section of data on the time when side effects usually appear that show that these vaccines are both safe and effective. Allergies have been in the news. So what about allergies? So there's been rare reports of a severe allergic reaction. This is called anaphylaxis, where you might get hives, have trouble breathing, your blood pressure might drop. These are kind of things that people carry around EpiPens for. For example, you might know somebody with severe food allergies. Right now, the data on this and how rare they seem to be pretty rare. For most vaccines, it's about 1 in a million. For the COVID-19 vaccines, numbers were released last week that suggest it's about 11 in a million. Newer numbers this week suggest that maybe 5 or 6 in a million. So it's a handful in a million. So these remain really, really rare. With that in mind, though, the CDC does have some recommendations for what you should do about the vaccines. For any places giving out the vaccines, they insist that there's safeguards in place. So there's on-site monitoring either for 15 or 30 minutes after you get vaccinated. And everybody will have the availability to respond to a severe allergic reaction with treatments, for example, EpiPens. So the pharmacies that we've partnered with all have the supplies and training in place to respond to these rare reactions that are treatable and reversible if they do happen. If you do have an immediate allergic reaction, even if it wasn't severe, to a vaccine or injectable therapy for another disease, you should ask your doctor if you should get a COVID-19 vaccine. So if you've had an allergic reaction to another vaccine before, talk to your doctor before getting the COVID-19 vaccine. If you've had an allergic reaction to any ingredient in the current COVID-19 vaccines, the CDC recommends that you do not get either of the vaccines. So you can go online and in the information that they hand out for each of the vaccines, you can look at the ingredient list. It's not very long. There's about 5 or 6 for each vaccine, and just review it. Most likely there's nothing in there that you've had an allergic response to before, but that's one thing that you should review. If you get an immediate allergic reaction after you get the first dose of the COVID vaccine, you shouldn't get the second dose. If you have a history of a severe allergic reaction that wasn't related to vaccines or other injectable medications, like food allergies, pet allergies, environmental allergies, you still can get vaccinated. If you've had a history of allergies to oral medications or family history of severe allergic reactions, you can still also get vaccinated. They make a recommendation if you're someone with severe food allergies and you have EpiPens, maybe bring your own EpiPen with you. But again, the vaccination sites will be able to manage these kind of things as they emerge. Again, to repeat about the safety, the COVID-19 vaccines are being held to the same safety standards as all vaccines. Before they were authorized to be used, the FDA carefully reviews all the safety data from the clinical trials. And the Advisory Council on Immunization Practices, which is an independent body of kind of the nation's experts in vaccines, also meets, reviews the data, and makes a recommendation to the FDA. An additional safeguard in Massachusetts that we put in place just for the COVID-19 vaccine was Massachusetts also had their own independent review panel look at the data and make their own recommendation to the state about the vaccine and whether to go ahead with using it. And there was unanimous approval to go ahead and use both of these vaccines. After the vaccines are authorized, there are these processes in place to closely monitor for side effects and the vaccine safety. There's some systems in place to collect data on side effects that might emerge after the fact or serious reactions so that the country is able to respond quickly if a signal were to emerge in that data that there's some unknown risk that we haven't been seeing. I would keep in mind at this point, I think we're 6 to 8 million people have gotten their first injection, and many people have gotten the second injection at this point in the country. So the vaccine is out there, and people are collecting this data in an ongoing way. There's a question about natural immunity. Isn't it better to get natural immunity? Shouldn't I just risk getting infected because won't the natural immunity be better than the immunity provided by a vaccine? The issue is we don't know. We think getting the virus is going to provide you with some protection, but experts don't know how long the protection lasts. We're reasonably comfortable that most people have a robust enough immune response that it will protect them for 3 weeks, for 3 months. That being said, there are people that do experience reinfection in that time. And the biggest concern here is that we don't know how bad your response to getting COVID-19 is. And there are people, even in groups that aren't felt to be at high risk, that have the risk of up to and including death after getting COVID-19. So the risks of the vaccine are much less than that. And we're working to establish how long immunity lasts. Again, reasonably comfortable data saying that there's at least 3 months of really good protection. Many signs are pointing to that the immunity will last much longer than that. And the benefit is you won't have COVID-19 and get sick from it. Vaccination is one measure to stop the pandemic. The vaccines are highly effective. Like I said, we still have to use all the other preventive tools in our toolbox to help limit the spread of COVID-19. So a combination of getting vaccinated and continuing with all the precautions that we have in place for the time being is going to be really, really important. Again, to restate this, COVID-19 mRNA vaccines will not give you COVID-19. None of the vaccines currently in use or under development use the live virus that causes COVID-19. People may experience normal side effects after the vaccination, such as fever. These effects are really signs that your body is building immunity. It takes a few weeks for the body to build immunity after vaccination. So you could get infected with COVID-19 before or just after the vaccination, because the vaccine hasn't had enough time to provide protection. You get some of that protection within a couple of weeks after the first injection. You get up to that 95% efficacy by the time you're about 7 days after the second injection. COVID-19 mRNA vaccines will not cause you to test positive on COVID-19 viral tests. So this is somewhat of a concern. If I get the vaccine, will I test positive for COVID? Not on the tests that test for the virus, such as PCR tests and antigen tests. There's a possibility with some of the antibody tests, which measure if you've had a previous infection. Some of those tests may show that you've had the vaccine, but there's actually ways to work that test to know whether you have those antibodies because of the vaccine or because of COVID-19, because you've had COVID-19. But again, for the viral tests, the normal tests, the things they call PCR and antigen tests, just getting the vaccine is not going to make you test positive on those tests. People who have gotten sick with COVID-19 may still benefit from a vaccination. So even if you've had COVID-19 already, there's still a recommendation that you get the vaccine. This is because you can get reinfected with COVID-19, and we don't know how long natural immunity from COVID-19 lasts. So to move in some of the logistics about how the vaccine is rolling out at advocates. And like Diane was saying, some of these details are changing daily. But what we know right now is Advocates is registered to receive vaccine supplies through partnerships with Walgreens and CVS. This is a federal partnership that was made with Walgreens and CVS to kind of roll out the vaccine into congregate care settings. Individuals and staff in group homes are prioritized in that first phase. And what's going to happen is there's going to be dates on the schedule where the medical teams from Walgreens or CVS are going to come out to our group homes and manage the vaccination process. We don't know, there's two vaccines right now, Moderna and Pfizer. They essentially have equivalent safety and efficacy with a few small details around what ages they're approved for. I think the Pfizer one is approved for, people up to 16, and the Moderna one might be 18 or vice versa. But with a few small exceptions, they're essentially the same efficacy and side effects. So we don't know. It's just kind of whatever we're getting supplied with are the vaccines that we'll be able to offer. The vaccine process starts this month. We've got we're in the process of getting every house kind of scheduled, and we're strongly encouraging staff and residents to get the vaccine to help protect everybody. At this point, it's a voluntary process. We're not making it mandatory. There is a signed consent form that's required from each guardian who wishes for their loved one to receive the vaccine. That form's been sent out via email or mail. You can also find a copy of the consent forms, which are different depending on if it's CVS or Walgreens, but those are also available on the website. And there's only a couple of sections that you need to complete. And if you have any questions, there's staff that can help you out with that. So our main message here is protect yourself, your family, your friends, your coworkers, the people you serve, and your community. Get vaccinated. We're really strongly encouraging this as the best way to help protect your loved one during the pandemic here, and to really for the collective good of helping end the pandemic that has caused a great deal of distress and despair for the people we serve, for our communities, for our families, and for ourselves. Participate in the VSafe program. It's a program being rolled out by the CDC to help monitor vaccine side effects. It's a text-based and app-based program that you have the option to sign up for after the vaccination. Share your experience with coworkers, friends, and family after you get vaccinated. Know the facts about the COVID-19 vaccine and kind of use yourself as an ambassador to spread, the truth about the vaccine from reliable sources. And visibly show you received the vaccine, such as by wearing a sticker or a button, but kind of be out there with your experience with the vaccine and help inform others' experiences. I'll stop the screen share. That's the end of the presentation part, and so we'll shift into questions.
Diane, you are on mute.
Thank you. I was just saying thank you to Dr. Viron for the presentation and asking Nicole if she'd like to very quickly give us instructions again about how you can ask questions. We're happy to take any and all questions, and we'll do our best to answer those. I can see that we have some in the chat already.
Absolutely. This is Nicole. I want to remind you there's 2 ways to participate in tonight's call. If you have questions or concerns, you can type your questions in the chat box and them out loud. There's also a hand raising feature. You can click on participants at the bottom of your screen, and there's a blue hand. You can click on that and that will notify me. And in that time, I'll call on you and you can unmute yourself. Also, if you have your video on, you can physically raise your hand and I can call on you. So we'll kind of just go with the flow here. I'm going to start. There's a couple questions coming through, so I'm going to start with those. The first question came through from Pamela. They said, should an individual who has had COVID within the past 90 days wait to receive the vaccine?
It's a good question. So the only time that you have to absolutely wait to get the vaccine is if you currently have COVID and haven't met the criteria to end your isolation period. And that's not because the vaccine will do anything, interact or cause you any harm, but the fact is we don't want to spread COVID around. So we're not going to be vaccinating people that actively have COVID. Once you've recovered from COVID, you can get it. There are some people that may want to wait those 90 days. That's fine, but you can also get it anywhere within that time frame as well. So it's kind of more of a personal choice. There's the potential risk is pretty low for reinfection within those 90 days, but also you can get it up to, as soon as you've recovered from, if you did have COVID, as soon as you recovered from it, you're eligible and can receive the vaccine.
Great. The next question is from Tina, and then I have someone raise their hand, so I'll call on them. Tina asked, are there 2 consent forms? We only have received a form from Walgreens, and I didn't see a CVS form on your site.
Craig, would you respond to that, please? Oh, and if you could,
There we go.
If the members of the advocates team could just identify themselves, that would be helpful so all the families know who we are.
Yep. My name is Craig Audette. I am the Vice President of Operations for Community Services, and I've also been the point person here at Advocates that's been working to coordinate our vaccine clinics with our programs and for other staff who are eligible to receive the vaccine. Currently, the first one we did get out was the Walgreens. We recently learned within the past few days that CVS has a handful of our clinics, primarily in folks that are in our DMH programs. So we have sent out the vaccines to the consent forms to those programs and people there. We'll be posting that one as well on the site. I just hadn't gotten that to Nicole yet.
Thanks, Craig.
Great. This is Nicole. Lois has their hand raised. Lois, would you like to unmute yourself and go ahead?
Yes. Could you describe the medical team that will be administering the shots, and who would be present that could deal with a reaction to the vaccine?
Craig, could you respond to that, please?
Yes. So the at this time, for the congregate settings, this will be staff that are either connected with CVS or Walgreens. So the pharmacy staff in those programs who have had training on the administration and would be bringing all of the supplies. In talking with a pharmacy partner of ours who are also working to set up a clinic, they have assured me that all the pharmacists will have training in CPR, first aid, will have appropriate equipment, including EpiPens, and be ready to intervene if there is a significant adverse event. These vaccinations will also be taking place at the congregate care program, so there will be staff on site who are familiar with your individuals as well, who can be called into action if needed in a medical emergency.
Thank you.
This is Nicole. The next question comes from Pamela in the chat. They say, what is your opinion on the appropriateness of receiving the vaccine if you have previously had the disease and were asymptomatic?
Mark, could you respond?
Yeah, so I think some of that question might be like, okay, if I was asymptomatic once, if I get it again, will I be asymptomatic that time? Does my body know how to handle this virus? There's no way to tell that, which I think leads me to say, like, I would still recommend, if you hadn't were asymptomatic, I'd still strongly recommend getting the vaccine, because again, we don't know how long you're going to be immune from the infection you had, and we don't know if you would have the same set of symptoms the next time you got infected. So I'd encourage even those cases for asymptomatic people who have had COVID to get the vaccine.
This is Nicole. Just seeing there's no questions or anyone in the queue, so feel free to type in the chat or raise your hand. I do want to say too, somebody did email me requesting to receive the presentation that Dr. Viron gave tonight. So we will be able to do that. Yes.
Can that just go out, Nicole, to everyone who's on the line tonight? Great.
Absolutely. Janet?
I don't have a question, but I would just like to express my thanks to the staff at Advocates, and particularly the staff at my daughter's residence. And I think they have done an absolutely wonderful job. And I have tried to support them in a lot of ways, but I would just like to say a public thank you.
Thank you for sharing that.
Can you see me? Anyone can see me? This is Lorraine Ravel.
Hi, Lorraine. No, we cannot see you. Did you want to turn video on?
Well, it doesn't make any difference. I just want to ask a question. Will staff at the day program be required to receive the vaccine?
Craig, can you speak to that, please?
Hi, yes, this is a good question. At this time, we are not making it mandatory that staff receive the vaccine, though we are strongly encouraging that all staff get the vaccine when they're eligible to. Right now, the state has different levels in terms of the order that they have different staffing groups go in. We're hoping that the day staff will be kind of towards the end of phase 1, and they will have the opportunity to get the vaccine, and we'll be encouraging that.
Okay, a follow-up question. When will we be able to bring our child home after they get vaccinated?
This is a really, really important question, Mrs. Ravel. Thank you. Beth, do you have thoughts about that family visitation at home?
I actually don't. I'm wondering if either Laura or Karen do.
Hi, Mrs. Ravel, it's Laura.
Yeah.
You could take your daughter home now if you wanted to.
Really?
The visitation guidelines changed. We had special guidelines for holidays, but regular guideline, I can call you. It changed. Karen, do you remember when it changed?
Ooh, I didn't know that.
Yep.
Yeah.
This is Karen, the VP of Developmental and Brain Injury Services. I believe we got new guidance. It was either in October or November, if my recollection is correct. And but Laura can follow up with you and speak more directly about your situation and talk through what might make the most sense.
Yeah, we always brought her home every Saturday. And I was wondering, like, usually we'd pick her up at 11 and have her back by 4. And is that okay?
Yes, I will call you and we will make arrangements.
Okay. I'm sure, if I asked the house manager, she probably would know, but I assume that.
Juliet's back from her trip, so.
Yeah. And she's fabulous. That house is fabulous, and we really appreciate it. And the staff, I know, loves Lisa.
We do.
And she loves her back.
I will call you. Thank you.
Really glad you asked, Mrs. Ravel. Thank you. I was going to say earlier in response to Janet Rattray's comment about the staff, we welcome critical feedback always. And it's also very nice to receive positive feedback that we can pass along to the staff. I know that you communicate your appreciation directly in lots of ways. And it's also nice for us to hear it here. I think one of the things that has been helpful to staff in just staying with this really hard time over these many months has been the support of families. So I want to express my own appreciation on behalf of all of our advocates team here to all of you for your steadfast support of the staff.
This is Nicole. I have a question from Pamela in the chat that I'll read. What about quarantine regulations after the vaccine? Will a vaccinated person be required to quarantine if someone else tests positive?
I can answer that. Basically, we don't know. So we're going to have to see. There's going to have to be new guidelines that come out. I think we're still trying to figure out. Meaning we, the large we, the country, the world, figure out how these vaccines work in the community and what kind of precautions need to be taken after you get vaccinated. So likely all the safeguards that we have currently will stay in place until we have enough data to make these kind of decisions on. And then at that point, I'd expect some guidance from, the CDC or the state around how this would affect the quarantine periods. but we don't have any of that yet.
Thank you, Mark.
This is Nicole. I just want to make note that there are no questions in the chat or anyone with their hand raised, so feel free to pop those questions, comments, concerns, anything in, and we can help get those answered.
You know, to Dr. Viron's point in response to that last question, it's just an kind of a reflection of how this is continuing to evolve. And I think the federal government and the state and advocates, you know, we're all continuing to develop procedures and protocols as new information comes in, and following the very best guidance that we have. So that will continue for a period of time, I think.
Yes, Ellen, feel free to unmute yourself.
I'm just wondering, how will guardians and parents be informed when their child's group home is scheduled for vaccination?
Mm-hmm. That's a great question. Let me ask either Craig or Beth, or a member of your team, Beth, who may have the answer to that.
I think this is probably best answered by Laura. But Laura, if you think Craig knows, you know, we're just figuring this out now. We're getting this information really rapidly. So it's rolling out really quickly. So Laura, if you feel like you can answer it, please go ahead.
Sure. You will hear directly from your son or daughter's program manager or program director. It is coming up very quickly. So right now we have dates in the Northeast, but we do not have dates for other programs yet. But as soon as we have them, you will have them. I don't know if you want to add anything, Craig.
I was just going to add, we right now have about, across all of our programs, all our group homes, we have about 79, and we have confirmed dates for first vaccinations for about 33 of them. And we should hopefully over the next week or so be hearing about dates for most of the rest. So please keep tuned and continue checking in with your program contacts as they will be getting this information hopefully soon.
This is Nicole. Pamela, would you have your hand raised? Would you like to unmute yourself?
Yeah, sure. Since I'm asking so many questions, I thought I might as well unmute myself. So I was just wondering about, you know, how we're managing the extra support that the residents, all the residences might be needing during quarantines. I would imagine that just as maybe as soon as one residence comes off, probably another one has to go on, and then another one has to go on, and then another one goes back on. So I'm wondering how we're doing that, you know, or how they're getting extra support, or are they getting extra support, and are the day programs helping out that way, or how that's kind of being handled?
This is a really important question. Beth and her team are really managing all this. So Beth, let me suggest that you respond to the question.
Sure. This has been really an incredibly challenging year for us for exactly the reasons that you just mentioned, Pamela. Trying to make sure that our staff are not completely burnt out by all of these quarantining of homes. We have worked hard at offering additional pay to people and additional options when a house is positive. So if a home is positive with an individual living in it, we pay the staff double what they normally get paid. Sometimes we go to actually having staff live in. Some staff prefer that to coming in for shifts during this time, and we pay them what would be almost the equivalent of getting about $5,000 for a week which is good pay for them. And then we've also added a little bit of what we're calling hazard pay to all of our direct care staff in our congregate care settings. So increasing their rate of pay a little bit during this time. We wish we could do more. They deserve it so much. But we are doing that. So, and then we have a relief pool that we're trying to use to help support these programs and these teams. And we've even had, you know, Laura's got a director who has moved into some programs a couple of times now to support the programs. So people are sort of like all hands on deck. Laura, do you want to add anything to that? Or do you think I covered it?
I think you covered it, but I also want to add that advocates support departments have been incredibly helpful with food shopping, PPE delivery. So it's a whole agency team effort to support every program that goes on quarantine, including parents have been helpful.
Thank you. That's been helpful. I have one more question as long as I'm unmuted. Laura, is it possible somewhere to kind of maybe, use the word post, but whatever you want to do, the visitation guidelines as they change, so that we know, what we can do in terms of going to the house, not going to the house, having someone come for the day, versus overnight, if that's a different thing, or is there a way to kind of keep track of all of that?
Yes.
Okay.
I can send that out to you.
Oh, great. Thank you.
You're welcome.
Thanks.
In addition to that, Laura, we should be sending it out in the regular family communications. So we've tried to keep up with changes that are important for families and guardians to know. There have been a lot of those, and it's possible that we missed a couple, but that's Nicole's job, along with the team here, to ensure that regular communications go out to families and to guardians, along with communications you might get from program managers and staff. So we'll kind of redouble our efforts on that. Karen, were you trying to get a word in response to the last question?
I was just going to add that we also have our nursing teams supporting residents. All of our staff have been trained in COVID protocols and get retrained in COVID protocols around infectious disease. But when we have an incident that occurs in a home where we believe that there may be someone that has symptoms, whether it be someone we support or a staff, our nurses get involved and meet with the staff, retrain them, and support them through the duration of the quarantine, working closely with Dr. Viron, the leadership, and the local Board of Health. So that's another piece that we have within the organization of support to the staff.
This is Nicole. I wanted to add to what Diane was saying, that we do, in addition to emailing out communications to families, we are updating the website as much as possible. So if I'm going to drop the URL in the chat, but if you just go to our website, the top of the screen actually has a green button that says read updates on COVID-19 and advocates. So we are doing our best to keep the updates for families on that page updated as much as possible. So we will get the latest, if it's not there already, the latest visitation guidelines up on there. And so then I have a couple comments in the chat. The next one from Ria. I agree that the staff have been wonderful during this entire time. I was wondering though, if staff refuse the vaccine, will they continue to work without any changes?
So thanks for that question, Ria. The answer to that is, for now, yes. We are really focused on providing a lot of education and support in decision-making for the staff regarding the vaccines. So this is getting underway starting Sunday. We're going to be monitoring how it's going. Are staff agreeable? Are they willing? Are they getting vaccinated? And really trying to assess for those staff who are not, what do they need? Is there something that we can provide to them to help them make a decision that we feel will be best for them and for all concerned? So I'm quite hopeful that this will go well, and the staff will make the decision to be vaccinated. For now, we're gonna let this unfold a bit for the next week or two, and see how it goes, and continue to kind of very heavily educate and support.
Diane, if I could add to that.
Sure.
I think the important thing to remember here is that my understanding of this vaccine, and I think that Mark can either tell me I'm wrong or confirm this, is that the real protection is getting yourself vaccinated. Being vaccinated does not necessarily mean that you can't spread the vaccine. Being vaccinated means that you will not get very sick if you get exposed. So I think that as much as we want all our staff to be vaccinated, what's really important to me is that the people that we serve get vaccinated. So if I've got that wrong, Mark, please correct me. But I think the big thing is to get the individuals we serve vaccinated so that they won't get sick if they're exposed, or at least they won't get sick badly.
It's Mark. I'll just echo what Beth has said. Based on, the way the studies were designed for these vaccines were to see if they could prevent you from getting the illness COVID-19. And they are remarkably effective at that. That's what the studies were designed to test. If you get infected with SARS-CoV-2, do you end up developing the illness as COVID-19? They're 95% effective at preventing you from developing that illness. The time will tell if they prevent transmission. We don't have enough data right now to say definitively that they do or not. It's trending in the direction. It seems to be that yes, it will cut down on the transmission of the virus. But what Beth is alluding to is that we don't know right now. If you could get the vaccine, you could still carry the virus in your body and pass it to somebody else. Well, you may not get ill. The other unvaccinated person may. So again, we don't have the data quite yet to know how much protection the vaccine provides against transmission, but we do know it is remarkably effective at preventing you, the person who gets the vaccine, from developing COVID-19, the illness from SARS-CoV-2.
Thank you both.
This is Nicole. I just want to make note that we have about 10 minutes left on tonight's open forum. So feel free to drop more questions or raise your hand. Some comments in the chat. One from Pamela says, thank you everyone for your hard work during this time. And one from Joy as well. I just want to say a very big thank you to all Advocate staff, OSA brother, and I greatly appreciate all your concerns, hard work, and staff and coverage possibles. Thank you. Possibilities. Thanks.
Thank you both for those comments. So as Nicole said, we've just got about 10 more minutes. We're happy to, this is not your only opportunity to ask questions or give us feedback. You can always do that through staff or directors. You can email me directly or call, but this is some open time we have right now for a few more minutes, that if there is something on your mind that you'd like to share or ask, we're happy to hear it, and we'll do our best to respond.
This is Nicole. Bob says in the chat, thank you to the Advocate staff at all levels for a great job.
Thank you, Bob.
And Ria says, again, thank you for all for your help. It is appreciated.
Thanks, Ria.
This is Nicole. Oh, never mind.
You've all been so good about acknowledging the efforts of the staff and how hard it's been for staff, so which we appreciate a lot. And I just want to acknowledge how really hard it's been for families. It has been a long, hard year, and you know, I can only imagine what it's like for you as family members to be dealing with all of this.
This is Nicole. Pamela, would you like to unmute yourself?
Sure, only because we have a few minutes. This isn't a burning question, but it is a question that might, that I would be kind of interesting to know the answer to. At one point when I remember speaking with DDS, they indicated that during the pandemic, regarding, all kinds of different things like whether or not a family could bring food to the house, or whether or not they could, enter or exit, or which exit or entrance they needed to use, et cetera. All these things that varied tremendously, not only from agency to agency, but maybe even from house to house, depending on perhaps that particular house. And I'm just wondering if there are any, I guess, ways that you're sort of getting that message out. Like, for example, do you have a blanket policy, like people shouldn't bring, families shouldn't bring food, let's say, a tray of food for the house to share at this time, or families shouldn't, enter. I know entering the house in general has been has been kind of across the board, not recommended, but in terms of how families can or can't participate, do you have any, kind of overarching rules about that, or does it really just depend?
So I'm looking at Karen and Laura for this.
So really, we do have policies that there is no food allowed during family visits. But to be honest, it depends on which house, because we do in-person visits, but it really depends on the group living environment because of spacing, individuals' ability to separate themselves. We do have identified entrances and exits, but it really truly depends on the house.
Okay, that's kind of what I thought. Yeah.
Not all group homes can have in-person visits, sadly.
Thanks, Laura.
This is Nicole. Just want to note we have about 4 minutes or so, and there's no one in the queue, so please feel free.
Can you tell me the status of the day programs?
Thanks for your question. So Karen, can you comment on what's going on with the day programs currently?
Sure. Currently the day program at 290 Elliott Street in Ashland is open and operating. We have a number of individuals I learned about this week that have not been attending due to quarantine related things, or family members not wanting them to come into the program. But the program is up and operating, as well as we have remote services happening to a number of individuals. Did that answer your question?
Ronald, did that answer your question? Sorry, we couldn't hear you. Oh, Ronald keeps going. Mute and oh. Ronald, are you there? Oh, Ronald keeps going unmuted and muted and unmuted. So I'm not sure if we haven't had confirmation from him if that answered his question yet. I'll message him.
So any last comments or questions before we close? I think people are beginning to drop off.
Yeah, so Bob just says I need to drop, folks. Very helpful information. Thank you. And it looks like Pamela has her hand raised again.
Yep, and then I will need to drop off as well. But I'm just wondering, after this is all over and we're on the other side of it, would you consider keeping periodic Zoom sessions like this for other meetings that you may want to have, or touching base with families? Because I feel like this has been a real opportunity, and in a way, allows some of us to be able to attend things that we would never maybe be able to attend in person. So I just wanted to throw that out there as maybe a thought. We'll all be sick of it. I know we'll all be really, really sick of it. So not right away, but maybe as a, down the road thinking, well, we were able to reach a lot of people on Zoom, and maybe we could have an annual or biannual informational session of some kind. I don't know, just a thought.
I can say I think that's a beautiful idea. One of the things we tried to do sort of midway in the last year was talk with the advocates community about like, what have we learned from COVID? What kinds of changes did we have to make that ended up having some benefits, and what kinds of things do we never want to do again? And I think it might be good for us to also ask family members, during this terrible time, were there some things that worked well that we would like to hold on to? And a periodic Zoom call perhaps is one of those things. Some of our staff have told us that they have felt closer to senior people in the organization as a result of these kinds of calls. So I think that's a great idea, and we'll absolutely consider that going forward.
Great. Pamela says, thank you again for everything.
So I can see, maybe Ellen Brown has her hand up.
Ellen?
Oops, you're muted.
Hold on. There you go.
One of the positive things that came up for our family was it was very good, while we could not visit in person, to have FaceTime capabilities. And I think certainly every resident should have a phone with FaceTime capabilities so that we can see each other on a regular basis, just to assure the residents that, we haven't gone away, we just can't come in.
Right. I think that's a great comment. Thank you. So it's 6 o'clock, which is the time that we allowed for this. It's has been winding down, so I think we'll bring this session to a close. I want to thank everybody on the advocates team for being here, and Nicole for moderating, Dr. Viron for the presentation, and to all of the family members for all of your support, and for joining us tonight. Your excellent questions and your really good feedback and suggestions. So it was great to have you on the line tonight. Thank you all, and stay well and stay safe, and we'll see you again. Bye, everybody.
Bye. Thank you.